Hello, my name is Betty Morgan, and I'm Vice President for Business Development here at the Valdosta Lowndes County Chamber. We've been working remotely, just like everyone else has, for the past several months, and we've been doing our very best to try to make sure that we kept our members and our community informed as much as possible about all of the material that's been coming through about COVID-19. And now that we've been given the green light to go back to work and to opening our businesses back up, there's still so many concerns about how do I keep my employees safe? How do I keep my customers safe? How do I keep my family safe? And so today I'm very happy to have with us Sean Castillo. He is with the Georgia Tech Enterprise Innovation Institute for the Department of Safety, Health, and Environmental Services. And he's going to share with us some of OSHA's compliances, some of their regulations, and to help us to understand a little bit better about how we can keep ourselves safe. Thank you, Sean.
Hi, everyone. My name is Sean Castillo, and I'm an industrial hygienist with the Georgia Tech OSHA on-site consultation program. I'm going to talk to you a little bit about today about COVID and what OSHA is doing to enforce their standards and just the guidance that they're giving at this time. I want to thank Betty Morgan for inviting me to talk to you all today and for disseminating this video. I'll also be giving her the slides of this in PDF format for you to use and our contact information that you can reach out to our actual Georgia Tech OSHA consultation program for further discussion with us on a one-on-one basis and a lot longer discussion. A lot of what I'm going to go in today is pretty nuanced at times, and it requires a lot longer time than what we're about to give it during this short presentation. So thank you all for joining me, and I hope everyone is staying healthy and happy as they can during this time. So going into the beginning, there has been COVID-19 enforcement guidance that has taken effect on OSHA as of May 26, 2020. It's important to note that OSHA's enforcement guidance and memorandums and everything are coming out constantly, so things could be changing from week to week. It's important to be checking their website very frequently to see if anything is changing, if old memorandums are still in effect, if they've been rescinded, and things like that. So the main website you can go to is osha.gov/coronavirus. So this is a lot of wording, but we're basically saying that OSHA at this time is still doing inspections, albeit in different ways than they usually have before. So OSHA is still investigating complaints, investigating notices of imminent danger if there have been fatalities. However, when possible, they are doing it virtually and from a distance. And they're trying to go more towards some of the highest hazard industries, so things such as hospitals and those of the matter who could have impacts from COVID at a higher capacity. But if an employee at your facility puts in a complaint, OSHA will still investigate it. They just might do a phone call, and it might be something that they have to do a follow-up later on. Just because there is a pandemic, this isn't the time to stop following OSHA guidelines and regulations. So if you have machines in your workshop, those still have to be guarded. If you have lockout tagout procedures, those still have to be followed, even though we are worried about this pandemic, because we still want to protect our employees in all the normal ways that we do. In all instances where OSHA is doing inspections, it's really up to the area director on how they want to go further. So if they want to do a virtual meeting or a phone call to do the visit, they might decide on that depending on the risk and the hazard to their own consultants as well. And again, this is just displaying what happens when OSHA goes out to areas with elevated transmission. They try to do everything as distant as possible, as far away as possible, or their safety and health officials and their officers, they're using the PPE that's required. So again, some helpful links and interim guidance. Here's one of the websites with their enforcement response for coronavirus and how they're going to enforce that. So this kind of details exactly how OSHA officers are going in. And it's a little more longer than what I just said, but they're basically still doing inspections. They're still running. They're still operational, just from a distance at times. And then also information on how to determine if COVID-19 is work-related, and we're going to get into that a little farther down in this presentation. So basically what OSHA is doing at this time is they're working closely with CDC and NIOSH. And NIOSH is the National Institute of Occupational Safety and Health. And they're actually the research arm of OSHA. OSHA is the regulatory arm. They're monitoring the pandemic. They're not just, in some ways it is business as usual, but in other ways they are taking the precautions and they're making guidance for industries. So the risk of exposure they've determined in many workplaces reflect the risk of general public in the community. So in some places in Georgia or rural Georgia, you might have a few factories, and that's pretty representative of the community because your community is the large workforce of these areas. And they also go in to say that risk increases when workers have frequent, close contact with the general public and other coworkers. So that's something we're definitely worried about during this pandemic. So this basically just goes into a list of some sectors that have increased risk. So if you work in any of these, such as healthcare, emergency response, mortuary services or death care, airlines, border protection, or any kind of screening, those are things we want to look at. And then others may be at risk, such as food processing, so meat packing. And in Georgia, that's a big issue. There's a lot of meat processing, a lot of poultry, and it's hard to keep distance. It's hard to follow the guidance. So we really have to be creative in how we create social distancing or how we remove the hazard of COVID from these industries. Other areas and other workforces we need to pay attention to are construction, oil and gas, or just really any other sector where having that 6-foot social distance is hard to keep up. And again, which will be on a lot of these slides, is osha.gov/coronavirus for the most recent updates. So this is where I want to get into a little bit more, is some of the existing OSHA standards to protect workers from exposure. So, for instance, at the beginning, there is no COVID-related standard. So OSHA doesn't have a standard in their Code of Federal Regulations that says this is how you have to deal completely with COVID. However, there are a few standards and a few citations in place that can be related to COVID. There's not a specific one like there is for silica or lead or machine guarding and things like that. One of the first things I want to talk about, and some of you may be familiar with it, some of you may not be, but there's something called a general duty clause that OSHA puts out. This is basically a clause that whenever there is not some kind of specific OSHA standard involved, they can use this to cite. The reasoning that this could be an issue is if things such as ergonomics. So you may have someone who gets hurt from lifting at the facility, and they could use this clause. There are some requirements, so there has to be some kind of recognized hazard that the employee knows about or sees, and there has to be some feasible way to control that. So OSHA definitely could relate this to COVID. The other standards and OSHA requirements I want to go into are some of the ones that you see on the right of the slide, and those are things such as personal protective equipment. So this is something that every facility needs to look at, regardless of if you're in a pandemic or not. Basically, every facility has to do a PPE assessment of their facility. And so what this entails is that you look at every job task, and you have this written down too. It has to be documented, but you look through every single job task at your facility, and then you relate the risk to it. So if you have a welder, then you look at the risk would be flash, eye issues. And then you have to look at the proper PPE they would use. So you would have a welding helmet, and among other job tasks. If you need eye protection or if you need gloves because of abrasion, you would relate every single job task to a hazard to the required PPE. And this is something you have to have written down. This is something that comes in with COVID, especially if you are using face shields, or if you are using things such as respirators, which we're going to get to as well, which are considered PPE. And so right now, I'm not talking about cloth masks. I'm talking about actual NIOSH certified respirators, such as N95s, tight-fitting half-mask respirators or full-face respirators too, the ones you see with the cartridges. Other standard, and this PPE requirement, it isn't just the assessment. You also have documentation that your employees have been trained on this as well. Other things to look at are your eye and face protection in that standard. One I really want to talk about is the respiratory protection program. And so this in itself is a very nuanced discussion, and it really requires more time than we have. So if you want to reach out to me and we can talk, we could talk hours about respirators. But the main thing is, if you have mandatory use of respirators at your facility, you have to comply with the elements of the standard 1910-134, and this is the respiratory protection standard. As part of that standard, you have to have something called a respiratory protection plan. This is basically in writing about the respirators you have used in your facility, who's using them, how often they're using them, and why they're using them. As part of this program, anytime you're making someone mandatorily wear a NIOSH certified respirator, you have to do first one thing called a medical evaluation. So medical evaluation is making sure that they are medically fit to wear this respirator. So you either send them to a clinic where they fill out a questionnaire, or you can send them through certain online portals where they can fill out a medical questionnaire, and then the physician looks at it online and gives you a statement back saying if they're medically fit to wear a certain type of respirator. If not, do they need to wear a different type of respirator, something like a power air purifying respirator that actually blows air into your breathing zone instead. You also have to do something called fit testing. And so this is using some kind of substrate or using a machine to basically test the seal of your respirator. And this is very important if you have to fit test annually, and you have to do this anytime you switch respirators. So if you have an employee who switches brands of respirators, they need to be fit tested. If you have an employee who has lost a lot of weight and they are going from a larger respirator to a smaller one, they still need to be fit tested. And this is also one thing I want to stress, it's very important. If your employee has facial hair and they are mandatorily required to wear a respirator, they have to be fully shaved because it gets in the way of the seals. So even me, who doesn't have much right now, wouldn't be under compliance if I was wearing a respirator. Some of the other standards to follow right now are the bloodborne pathogen standard. It really isn't COVID related. However, some of the cleaning requirements that if you had an exposure control plan can be incorporated into a COVID response plan as well. Next in our order of business is the hazard communication program. This is something that most facilities will have if they have hazardous chemicals at their facility. And this is basically relaying the hazards of whatever you're using to your employees who are using them. And part of this is also having a written program that details where your safety data sheets are, what kind of chemical labeling you're using at your facility, how to read labels, how to read SDSs. But this was really important during the time of COVID because a lot of facilities are introducing new chemicals at higher frequencies than previous. And so you really want to train your employees on how to use these and the dangers of these chemicals as well. And with that, you also need to train employees before they ever use these chemicals and have that training documented. As well as with the respirator program, those employees also have to be trained annually. Last order of business, we're going to talk about it a little later, but with record keeping requirements, you still want to keep your record keeping if that's something that you have to do at your facility. However, now there are instances where you do want to record workplace related COVID cases, and we're going to talk about that a little further on. So again, OSHA is putting out some guidance about exposure risk, and areas that our exposure is very high. They've determined things such as healthcare workers, so doctors, nurses, dentists, paramedics, EMTs, other healthcare lab personnel, again, morgue workers, they have high risk due to the nature of what they're doing. So more needed time goes out to what they're doing and to making sure that those employees are safe. Further, again, healthcare, we talked about that, medical transport, and again, mortuary workers. Exposure risks that are medium, so maybe not as high, but you still need to think about what you're doing. So jobs that require frequent and close contact with people who may be infected with COVID. So areas such as retail or transit, so if you have bus drivers, subway operators, taxi drivers. This is one thing you also want to think about if you have carpools or van pools. How are those employees distancing if possible? Or just any workers in other transportation operations. So if you're at Metro Atlanta like me, or other places where you have subways and rail cars, that's something you want to look at. And then they go into lower exposure risk. So with people who are known to be or suspected of being infected, they don't have contact with those people. So if you have an office worker who comes in and they don't see anyone else and they just hole up in their office, that's someone at a lower risk. So again, we want to talk a little bit about OSHA enforcement in this time. because that's the main thing we want to look at. So OSHA typically responds to emergencies, including disease outbreaks, in a technical assistance posture. They also provide compliance assistance to employers to help ensure workers are protected. And that's something we're doing at Georgia Tech as well, which we'll discuss at the end. They provide technical assistance and support other federal agencies, and they implement interim enforcement plans for investigating COVID complaints while ensuring the safety of workers, employers, and inspectors. And during their enforcement authority is that during everything that's going on, they operate in technical assistance support mode rather than an enforcement mode, although they do have the ability to enforce and create citations as well. So we're in Georgia, and we still run under federal OSHA. We're not a state-run state. One thing to note is that in this time, there is enforcement discretion on what's going on. So they've put out some memorandums about how they're going to operate with facilities at this time, which is what everyone's really worried about. So the first order of business I want to talk about is just their enforcement discretion in the first place. So OSHA has come out, they've put a memorandum, and they've said that they will be offering discretion on how they cite facilities whenever there's complaints or whenever they're doing an inspection, because they're not working at the same capacity. So for instance, and this is just an example, but OSHA has given some examples of how they will exercise this discretion, we'll say. So if your facility has something called a hearing conservation program, this is something where if your employees are exposed to a certain level of noise, they have to be put into a program where they have to be offered hearing protection, and they have to have something done called an audiogram. Audiogram is basically just a hearing test. And so this hearing test involves either a mobile van coming out to your facility to test your employees, or you send them off to a clinic. And so one of OSHA's examples is that during this time of the pandemic, if you can't have that mobile van come out because they are not letting their employees do that, or you can't send your employees because clinics aren't offering those services during this time, OSHA will exercise discretion on this citation because it's something that's really out of your control. And they have also noted that whenever they do things like this, they'll make notes of it. They'll give you some kind of information and guidance on how to proceed. They might expect you to put in some other interim controls, so forcing your employees to wear hearing protection during this time, even though it's not required. But they will note it, and then they will design a system to come back and follow up with all these facilities once everything kind of blows over a little bit. But they are exercising discretion. They've also given other examples. So if you have a consultant who usually comes in and does your fit testing, your annual fit testing, but because of travel restrictions or just restrictions in general, they can't do that. OSHA is offering discretion on things like that as well. So you still have to follow the standards. You know, there's some things you really can't get away with, but OSHA will exercise discretions on certain things that they understand that are out of your control. But the main thing I want to note is that these are all in good faith. So basically you're giving OSHA evidence that you are doing your due diligence and you're doing everything you can to stay in compliance. There just might be a couple of things that are out of your control. So going a little more into some of their discretion, we have things such as the respirator protection memos. And so we've had a lot. They've started as healthcare memos, and then they've kind of extended more towards general industries, but they have put out some memos about things such as doing your annual fit testing. So whenever you have fit testing for respirators, you always do it before an employee ever uses their respirator for their job. You do it annually. And OSHA has come out and said that if there are limitations on doing that annual fit testing due to the pandemic, they will exercise discretion based on if you have done all your due diligence and exercised all options. They've also given some guidance about using N95s or using other kinds of respirators that are certified under standards of other countries when N95s or other respirators here cannot be found due to shortages. They've also given some guidance on extending the use of N95s or reusing N95s due to shortages. And the reason that this is an issue is because those N95s are really supposed to only be used once. They're not supposed to be reused or extended use past their one-time use. But OSHA is giving some discretion on these, and it's really important to go to this website and read through those to see if they're applicable to your facility. The one thing to notice, and what OSHA really wants to discuss in this too, is that just because you know you can't find N95s and you automatically want to reuse or go to a different country's respirators, that there are other options you can look at here in the States. And those are things such as looking at cartridge respirators. So the half mask ones that cover here and they have the cartridges, or a full face, or the power air purifier, which again, you have a battery pack and it blows into a hood. So those are some other ways you look at that. They also really want to enforce that if you have processes that employees usually wear respirators, but you can't get respirators because of the pandemic, you can't just go and do business as usual. So if you have someone who's, not even protected against particulates like COVID, but you have someone who is overexposed to isocyanates, or you have a paint booth or anything along those lines, you still have to protect your employees. You can't just send them in there without respirators because you can't find them. You have to either put in some kind of controls where you get rid of the exposure or find another means. So that's not something you can just disregard. But again, these memorandums and guidance come out all the time. So it's really important to be checking this website to find out what's applicable at this time and if something is still enforceable or not. The last part of here you see on the bottom left is that the recording and reporting of occupational illnesses and injuries, OSHA has put out guidance as well. And this one has been a hot topic, and we have a whole slide devoted to that. Like I said, OSHA has put out a lot of guidance about materials for workers on how to stay safe and healthy during this time. And they talk about how to implement the hierarchy controls, which hopefully some of you have heard about. They've also put out guidance for certain industries. So if you are working in construction or manufacturing, package delivery, retail, they have certain guidance and fact sheets for you to use at your facility with tips and tricks to keep your employees safe. One of the big ones that just came out in accordance with CDC or conjunction with CDC as well was the guidance for meat packing and processing. So in Georgia, there's a lot of poultry, there's a lot of meat packing. So this is something that definitely affects us, but they give guidance on how to clean shared meat packing, what kind of PPE can be used, how to manage employees with symptoms, and also things such as how to create barriers if you can't do social distance. So there's, social distancing is the really hot topic, but there are ways to do that, and we'll go into that a little further. They're also giving guidance on how to help employers comply with the OSHA standards. The guidance shows the risks, hazards, and it talks about the standards, airborne precautions, and the use of protection. And guidance should be adapted based on the employer's hazard assessment and workers' task. So you mold the guidance to your facility after you've done your initial hazard assessments, after you've done your PPE assessments, you've contained all of your hazard communication, all your SDSs to know really what's in your facility. Further, this is also with CDC guidance as well, but it's really important to teach your employees to practice good, frequent hand hygiene. Washing your hands is really the best thing, and having multiple stations where you can do that or use hand sanitizer is great. You really want to avoid touching your eyes, nose, or mouth, and I know that I'm guilty of that all the time too, so it's really something you just want to reinforce when you can. And avoiding close contact with people who are sick. So furthermore, OSHA, in conjunction with every other health agency, really talks about implementing protocols for cleaning and disinfecting high-touch surfaces in the work environment. So this is something that's really great if you already have bloodborne pathogen standards or an exposure control plan. You just implement further cleaning protocols for COVID, or you can create your own, and we have some templates you can look at. But really what's important about this is it's important to really look at places that you might not have thought about recently that are high frequency. So if you have doors going into your break room, if you have microwaves or fridges that employees are still using, that those are cleaned at a regular basis. If you have touch keypads where you're clocking in, are those being cleaned? Are employees making sure that those are being disinfected as well? And just other areas where you frequent. The other important thing about this is that you're using disinfectants that are on the EPA registered list of disinfectants. You can find that through the EPA website. OSHA also offers it. And this basically shows you a list of products and chemicals that can be used to kill COVID-19. There are a couple important things about this list that you need to look at. One is something called contact time. So contact time basically shows that you put on the disinfectant and you have to let it sit for a certain amount of time to inactivate the virus, kill it, and then you can wipe it up. A lot of these disinfectants you can't just pour on and wipe up a second later. You have to let them do what they're designed to do. Another aspect of that list shows the type of surface that you're doing. So is it porous or non-porous? And this is basically saying, does it seep through or not. So you want to look at those things when you're looking at the registered list of disinfectants. CDC provides more guidance, and it's really important here to take home the information that hazard communication really needs to be reinforced. So you're introducing new chemicals at a higher capacity than normal, so your employees need to be trained on what they're using and what's being used around them, and also the use of these chemicals. So for instance, with bleach, you can't be mixing bleach just with any kind of other chemical. You can't mix bleach with ammonia, or you create off gas that can be harmful to your employees, and that will be harmful. Other parts about bleach, you can't mix it with dish soap and other things as well. And to properly protect your employees, bleach is something that should be diluted and made daily. This isn't something that should just be sitting for months. You should be making new solutions to have the best effect. So again, CDC provides more detailed guidance, and you could definitely reach out to us at Tech2 to develop some cleaning protocols as well. So further guidance, we've talked about it, but training your workers about the risks to COVID, what to do if they've traveled to high-risk areas, how they quarantine, but also really just how they protect themselves in your facility. Some of the standards, again, bloodborne pathogens, PPE require worker training, hazard communication requires annual worker training, respiratory protection requires annual worker training, and this is something you want to make sure you have documentation of, because OSHA is going to look for that as well. And one other thing I want to reinforce again with the PPE, you really just want to look at every single job that you're doing at your facility. So if you have someone who's doing temperature screenings, they're at higher risk of COVID because they're just seeing a higher amount of employees in a close proximity. So that's someone, when you do your PPE assessment, we would recommend having them in a respirator, a face shield, things like that. But it's important to know if you're doing that, you have certain written procedures and other procedures you have to follow, like the PPE assessment and the respiratory protection protocols and procedures. So OSHA also reinforces the idea of the hierarchy of controls in this instance, and this is basically a method of determining what kind of controls are more suitable and what has more effectiveness in your facility. So at the top of our list is elimination, substitution, or engineering controls. So this is basically removing the hazard so that the employee isn't exposed. So for instance, and this doesn't have to do with COVID, but at one time I went out to a facility and they were welding and they used an anti-spatter spray for their welds that had methylene chloride. And this is a carcinogen. Instead, what they did is they switched it out for a water-based spatter spray. So they completely substituted the hazard, got rid of it. Engineering controls also can include increased HVAC. So making sure that you're just removing it or adding some kind of barrier so employees aren't in the same breathing zone. So you're removing that hazard. As you go down in the hierarchy and as you have less effectiveness, you look at things such as administrative or work practice controls. So this is rearranging the way the employees work. So things such as having arrows on the ground to make sure that employees are only walking in one direction as to not cross with each other to prevent contamination and infection, or things such as having staggered lunch breaks. So if you think back to an elementary school, you would have the first graders eat and then the second graders will go. In your facility, you can switch that around. Instead of everyone going to eat lunch at 12, you have maintenance go, and then you have anyone else on the production line go, and so forth. And so you can make those work practice controls. Or now we're not going to be using the clock in, or you clock in staggered shifts, things like that. Or just, allowing people to eat outside or eat in their cars when we formerly didn't. Those are also good controls, but they have less effectiveness because the hazard is still there. And as we get to the bottom of the hierarchy, that's when we get to our PPE. And the reason this is at the very bottom is because the hazard is there and PPE isn't infallible. So if you have gloves, if you have respirators, they're subject to leaks, they're subject to perforations and tears. And so if that breaks, the employees are right there with the hazard. So again, we're looking at engineering controls such as isolation rooms, other barriers, admin controls, limiting access to patients if you're in healthcare, sharps management, worker training, make sure they know the rules and procedures. And then PPE includes gowns, gloves, goggles, face shields, N95s, or other more protective respirators. So now going into the actual record keeping of COVID-19. So a lot of facilities already have to do their OSHA 300 logs if they're not exempt, and they might be familiar with some of the requirements. This is a conversation that needs to be longer than I'm giving it today, so feel free to reach out. But for companies who do have their record keeping requirements, if there are work-related COVID-19 cases, those have to be indicated in your OSHA 300 logs. And there are some criteria for when they have to be met. So they have to be recorded if a case is a confirmed case of COVID-19, if it's work-related, and if it involves one or more of the general recording criteria. So if you have medical treatment beyond first aid, days away, an employee has to do some kind of restricted work or job transfer as a result of that illness. OSHA recently has been putting enforcement discretion on this and for facilities, and they were taking more precaution in facilities such as healthcare, any kind of security, police departments, things like that. However, you still have to record if it's a work-related, and if there is that evidence. So, for instance, if you have a facility and you have 8 people on a maintenance group and you have 100 other employees, and the only 8 employees who have positive cases of COVID are the ones who work together in that maintenance group, that's pretty good evidence that it was work-related. So that's something you have to put on your logs. And putting these on your logs isn't necessarily a bad thing. It's just having those record-keeping requirements that OSHA wants. And this goes on top with your other record-keeping requirements that you still need to be doing for injuries that are in the criteria of 1904.7. And it's also important to note that the reporting requirements are still into place right now that you need to be aware of. So there's recording where you put it on the log, and reporting, which is different. So if you have a fatality at your facility, you need to notify OSHA within 8 hours through a phone or through their online channel as well. And you have 8 hours to do that. If you have inpatient hospitalizations, loss of an eye, amputations, those still need to be reported as well within 24 hours. So they're still running how that usually runs. And then to my knowledge, next year too, you will still be submitting. If you electronically submit your logs, you'll still have to be posting your 300-day forms as well. So in time of COVID, not only are there things the employers need to know, but the employees have rights as well. So workers have the right to raise concerns with OSHA or their employers about COVID. They also have the right to receive information and training on job hazards in their workplace, and you have the obligation to provide them with that training depending on the standard, but also just with general COVID training. You can't retaliate against employees for any of these things. So there are certain protective activities such as requesting PPE, wearing PPE, reporting a work-related injury or illness to an employer or OSHA, reporting unsafe conditions, requesting guidance. They cannot be retaliated, so they can't be fired, laid off, or demoted just for those things. And this would be an instance too where if, say you have a 0 injury quota for the month, you're really going for 0 injuries, and you can't retaliate for an employee just because they reported something when you didn't want them to report. They also have the right to refuse to perform tasks under good faith if there are reasonable apprehension of serious injury or death. They refuse in good faith to expose themselves to a hazardous condition, which is there. There's no reasonable alternatives. There's insufficient time due to urgency to eliminate the danger. And where possible, sought from the employer when we're unable to obtain a correction of a dangerous condition. And they have the right to send in a complaint to either you at the facility or OSHA without retaliation among them. So going forward, OSHA has a lot of really good information. They have something called Quick Takes, which is a biweekly newsletter where they really send updates about what's going on with COVID, and they also send you updates about some enforcement cases. So they show you citations that have been happening among the United States. And these are really good for you to avoid as well. They also have social media profiles, and you can contact them further. That's their number. So for me, I want to talk a little further about our actual OSHA consultation program. Again, I flew through a lot of this stuff because a lot of this stuff really does need more time. This is just a quick little intro. And we are the Georgia Tech OSHA Consultation Program. We're basically an on-site consultation program that comes out and does what OSHA would do if they came to your facility. So for instance, I'm an industrial hygienist, so I would go out to your facility. I would review all your written health programs. So I would review your hazard communication, your PPE assessments, bloodborne pathogens programs, respiratory protection programs, hearing conservation programs, among others. And I would make sure that they are in compliance with the OSHA standards. I would also walk your facility to make sure that there aren't any hazards that I see. And if there are, we get those corrected. With the health side too, is we offer industrial hygiene monitoring. So I go out and I do air contaminant personal monitoring with the pumps and the media, and also do noise monitoring as well. We also have a safety branch that goes out and they look at things such as machine guarding, lockout, tagout, entry into permit required confined spaces. And they also audit those written programs as well. We are a free program. It doesn't cost you anything to use our services. However, there is an obligation that you correct the serious hazards that we find when we're out there. So we give you a report, we tell you the serious hazards with the certain standards, and you have a certain amount of time to correct these hazards. We offer extensions based on good faith if you need them, but you basically send us documentation that you corrected those hazards and we close out your file. These are confidential visits. We don't report to OSHA. The only time we have any contact with OSHA is if you were reaching out to us, if it's a abatement assistance, so OSHA said to use our services, or if you just blatantly refuse to correct the hazards that we have given you in your report. This has happened very, very infrequently in the whole time that this program has been enacted, because we do work with you and we really want to make sure that you are in compliance, but most importantly, you're protecting your employees. Right now, we're doing virtual compliance assistance and virtual consultation. So we're reviewing things ahead of time by email, or we're doing meetings on Blue Jeans or WebEx where we talk to you and we review those. And when we are allowed to go back out to facilities, we'll do follow-up visits where we actually do walkthrough audits and or perform industrial hygiene monitoring and sampling. So we'll get you on schedule to do those. We're also just offering compliance assistance right now, like OSHA, about COVID. So if we've been doing a lot during this pandemic, but if you want to just contact us to set up an hour and a half meeting where we go through your actual facility and talk about what measures you're putting in for COVID, and what things you need to apply, what standards you need to follow, you can definitely reach out to us. My email's here, our website's here, and we can talk to you a little further one-on-one to have an in-depth discussion about how to protect your employees. We also have the Georgia Tech Manufacturing Extension Program, and they look at the manufacturing side, making sure that your supply chain is up to speed during this time. So again, I just want to thank you all for being here. Thank you for Betty for inviting me. We really want to stress there's a lot of information at this time, but it's important to know that OSHA is still operating, albeit at a different capacity. So it's important to still be following the standards. And if you need help with interpretation of standards or any kind of compliance or keeping your employees safe, I ask that you just reach out to us, and we will help you get up to speed and help you in any way we can, because we're a resource for this Georgia community. So once again, thank you, and stay safe and have a good rest of your day.